Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. I'm excited to have a fellow Coloradan here on the program today. Always excited when a dentist comes on and shares with other dentists and helps them grow. Dr. Dan Butterman, say hello to everyone.
Hi, very nice to meet you, and kind of funny that we're down the street from each other.
Yeah, so close. Great to have you on the program. I know we're going to talk a little bit about spear education today, but let's talk about you first. Tell us what made you become a dentist? How'd you get involved?
Yeah, I've been practicing for, about 31 years now. It's hard to believe it's been that long. Actually, I practiced with my dad, who was a dentist. So he had a practice here in Colorado, and I practiced with him for a short time before he retired. But it was kind of one of those things that I always wanted to do. And I think you see that in families. You see that a lot of parents that have kids that come in and join them. Same things happened to me now. My middle son graduated a year ago, and he's just joined my practice. So it's been a fun journey on the dental clinical side, which again, it's been about 31 years for the clinical side. I've expanded into teaching, and I've expanded into education, expanded into spear education as well. And now I'm currently also the chief dental officer for spear education.
Yeah, that's fantastic. I know that so many appreciate people like you that reinvest so much into helping other dentists. And we'll talk about spear education here in a little bit. Let me ask the question I always ask. What are some challenges and problems that you see dentists facing right now? What are you hearing? What are they coming to you and talking to you about?
I don't know what you're talking about. It's the easiest profession out there. There are no problems. I mean, the problems are universal. And it's the funniest thing because every meeting, every education event I've ever been to as a dentist, you sit down eventually at some point with dentists, and the conversations always center around really similar pain points. And currently, the pain points are a lot of it centered around staff and team and dealing with team members. And how do you, number one, replace somebody that's left? And number two, when you bring somebody new in, how do you onboard? And that's just been a massive issue. And while we may or may not have enough patients coming into the practice, there's always that question of, how do you get patients to say yes? My patients never say yes to this. How are you doing that level of dentistry? And the metrics are always those conversations and pain points where people struggle with.
So you do have those people that, my patients never say yes to this. Case acceptance is problematic for them, or keeping team members is problematic. And then there's these other people that are these magical unicorns that everybody says yes to them. Their team's all been with them for 15 years or longer. What do you think the big difference is between those people? I personally think a lot of it is just mindset. What do you think?
Well, I don't know that they're necessarily unicorns, because just to be clear, I teach and I speak with some of the best dentists in the world. And I will tell you that every dentist, even the best in the world, will struggle. They will have patients that say no. They will have procedures that don't go the way they want them to. So it's not that it's necessarily easier for one versus the other. There's just a system in place. There's a formula, there's a pathway, and we do it the same way every single time. We have the same conversations every single time, so we're not reinventing the wheel. And that's sort of critical to, number one, have clinical outcomes that you want, but also getting patients to say yes and to accept treatment. It's a pathway, and that's not obvious. It's something that has to be learned, and to stand on the shoulders of others that have done it before is probably the easier way to get there.
Yeah. So in your 30 plus years of practicing, tell me, what's one of the aha moments, like where a light bulb went off, something hit you that really changed you and your practice and the way that you practice for the better?
A couple of things. I mean, number one is that you don't have to necessarily practice the way your patients ask you to practice. You practice the way that you choose to, at the level you choose to. And I think when you're a new dentist and you're just starting out, we are sometimes so heavily influenced and say, yeah, but the patient asked for this, or the patient wanted to do this. It was an aha moment for me when I realized I can actually say no. I can actually deliver the type of care and treatment that I want to do. And if I don't want to do that, I don't have to say yes to everything. That was a big piece of it. The aha moment that on the case and treatment planning, this is kind of stupid, it's kind of funny to say, but the aha moment for me also on that side of it was once a patient said yes to treatment, shut up. Like just stop talking at that point. And I see so
Right.
many dentists talk themselves out of a yes because they want to over explain and over engineer. And it really is just about creating, showing why the need is there, having the patient trust and have confidence in you. And then once there is agreement, move on.
Yep. I think a lot of treatment is denied over a few words, not a few dollars. A lot of people think it's the money, but a lot of times it's just the words that are
Oh, for
used. So I
sure.
think makes a lot of
For
sense.
sure.
So let's shift and talk about Spear Education. So I know you're the chief dental officer at Spear. Everybody knows what Spear is. Everybody knows who Spear is. But if you haven't looked at Spear in a while, why should you look at Spear now and consider working with Spear?
Yeah, I think the biggest difference between Spear, and I'll talk from a clinical perspective first, the biggest difference is that the way we learn how to treat patients in treatment plan in dental school is very different from the way we teach at Spear. And we were very focused on single tooth. Patient comes in and you go tooth by tooth, figure out what the problem is and what the solution is tooth by tooth. Well, that doesn't get you very far in more complex situations. The way that we try and shift the focus is let's look at the whole patient. Let's understand their face. Let's understand where the teeth are supposed to be within their face. Let's understand, is there a bigger reason why we're seeing wear? We see tooth number 18 broken, it needs a crown. Should we just focus on tooth number 18? Or should we look at potential airway issues? Should we look at wear throughout the mouth? Should we look at other potential problems that one tooth just becomes a symptom of? And it really becomes really rewarding when you can take that single tooth mentality and transfer it into, I'm just going to make my patient better. I just want to make them healthier and treat their entire mouth, not one tooth.
Yeah, that's fantastic. So tell me some things that have changed with Spear. I think there's been some changes. I believe that Spear Education is a relatively new platform, isn't it? Some changes have happened there.
We've had some really significant changes on the Spear platform. Probably the most relevant one is that for most of our history, we've really tried to meet dentists at an incredibly high level and get them to be at that highest possible level. That's not changing. We still want to make sure we offer that highest quality. We want to offer elite education, but one thing that we really want to be careful of is we don't want to offer elitist education. And we've made the decision that there's a lot of people that are relatively new grads, maybe in that just recently graduated, because we know it takes 3 to 5 years before you even start feeling comfortable with some of the procedures. We know there's a lot of people that are out there that maybe want to get to that highest level, but before they can get there, they need to be good first. They need to really have some help on the hand skills. They need to really have some help on patient communication. I never learned how to talk to my patient. I never learned how to work with an assistant. I know how to prep a crown, but I don't know how to have all the conversations around it. And now I'm finding I have to do a lot of them and I have to do them very quickly and I'm overwhelmed. So we've got that big segment of the market that dentists that are relatively new, they need help too. And so we've developed a foundations membership site where, because often that group can't necessarily afford to come out for the highest level of education, whether it's the time away from the practice or the actual cost of it. So we wanted to come out with a very low cost membership level that gives anybody, that newer dentist, access to all of the level of education that we have on the virtual side.
That's fantastic. I want to talk about money for a little bit because I know some testimonials of some dentists. I've heard some testimonials of some dentists that have gained a lot financially from Spear. And I think that's important, right? I think a lot of people that listen to this show, they're definitely struggling financially or not where they want to be. And I know that clinical education can help out a lot with that because, and again, everybody knows I'm not a dentist, but you can get better, you can get faster, you can know what you're great at, what maybe you're not so great at, maybe you refer that out, and it helps you streamline your business and do better financially. But let's talk about the big cost, I think, of being in business and owning a business that's not financially related, which are things like stress, mental health, headaches, not being able to sleep because you can't stop staring at that ceiling fan at night. How can Spear help in those areas? Where have you seen some breakthroughs and changes with dentists as far as that's concerned?
Yeah, I mean, from the cost perspective, in my mind, there's only two ways to earn more money practicing dentistry. You can either do more of the procedures that you were doing before, meaning become more efficient and better at them, or add a service that you weren't doing, add treatments that you previously weren't doing. So we can certainly help in both of those regards to allow you to increase the income side of it. But the not sleeping is a big piece of it. The mental health and the not sleeping, that comes from a lot of things because dentists are incredibly hard on themselves. Sadly, a lot of dentists believe that they are only as good as their last patient. And that can be good and bad because if you did really well on your last patient, you may think you are better than you really are.
Right.
Or
Yeah.
it didn't go well and you may think you are far worse than you really are. And so those are the things that keep us up at night. And really not understanding why things fail, because we all believe that everything we do should last forever for the patient. And if they ever fail, we should pay for it again and it's our fault. And we beat ourselves up over that. So if we're going to be that way, and I would love to change that mindset because it's not true. I mean, it's just a fallacy that we've maintained. But the real answer is if you do believe that way and it is something that keeps you up and you have that type A perfectionist mentality, let us make you the best you could possibly be. Let us show you when things fail, why they fail. Not so you're up at night saying, man, I've redone this crown 3 times on this patient. I don't know why it keeps breaking. Let's understand the reason behind it. And I think those are the things that prevent you from sleeping at night is not knowing why things failed. Why did it break? Why did it not work? Why is somebody better than me? Really, it's just a misunderstanding of some of the bigger picture items that we can help with.
Yep. It's great information, great advice. The website is speareducation.com. Dr. Dan Butterman. Oh, let me back up a little bit. Go to the website, top right corner, request information, quick little form, some more information, learn more about what they have to offer. Dr. Butterman, thanks for coming on today. We appreciate you sharing.
Absolutely my pleasure. Thanks for having me on.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth-Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.